Alright, here is the last video on the reproductive system. There are a lot of changes that occur in the mother, in the gastrointestinal system, the urinary system. All the different systems all have to change in order to be able to take care of this baby that we've got going inside the mother. Now, due to the elevated levels of progesterone and estrogen, morning sickness is going to occur. Heartburn because there's crowding. Constipation also because there is things can't move as easily. In the urinary system, kidneys have an additional burden because they're also producing more urine, but they are also, as the baby gets older, you get the baby sitting on top of the bladder causing even more problems. Then you got the respiratory system. You got the vital capacity, respiratory rate's going to increase. The cardiovascular system, the blood volume increases. The blood pressure is going to increase. Then we have something called labor. This is childbirth. All right. It operates by a positive feedback system. Remember, this is there's two places in the body where positive feedback. You can have what's called a false labor. These are called Braxton Hicks contractions. This is where you think you're going into labor, but then you have to end up at the hospital, and the hospital says, nope, sorry, these are just false contractions. Go back home and wait until you're ready. Estrogen levels are going to rise. The uterine contractions begin. The placenta releases prostaglandins. Oxytocin is released by the pituitary, which increases labor so that the labor will continue, the contractions will continue. And then we can see here that as the baby gets ready, of course it needs to come out head first. Breech birth is the other way around. You definitely don't want that because the umbilical cord can be pushed around the baby's neck. We've got all these things going on. Then we have something called dilation. The cervix becomes dilated, meaning it opens up, and the full dilation is 10 centimeters. Remember that the head has to come through here, so it needs as much opening. So it softens, it becomes opened, and this is the longest stage at 6 to 12 hours of labor. Okay, so we have dilation. Then we have expulsion. The infant passes through the cervix and the vagina, and this can last as long as 2 hours, but it's typically about 50 minutes. Now, it's a lot faster in any subsequent birth. Normal delivery, again, is head first. You don't want a breech birth. That would mean that the butt would be coming out first, and you don't want that, again, because the umbilical cord can get around the baby's neck. Then we have two separate births. You have the birth of the baby, and then you actually have a placental stage where you deliver the placenta. This is usually about 15 minutes after the birth of the infant. The afterbirth consists of the placenta and the attached fetal membranes. And all of this needs to be removed and should be sloughed off in order to avoid any postpartum bleeding. Okay. We know that males are XY and females are XX. The gonads do not begin to form until about the 8th week, so you can't really determine whether it's male or female. And the testosterone is what's going to determine whether it is a male or female. The reproductive system organs do not function until puberty. Puberty begins about 10 to 15. At that time,
okay, so we have
males, the enlargement of the testes, that's going to
onset of puberty.
be the
one signal of onset
in
puberty.
females. Females will go through their first menstrual period. Menopause, though, would be a whole year has passed without any menstruation. That means that the ovaries have stopped functioning as an endocrine organ, and then at that point, it also childbirth ends because they are not producing their eggs. All right, we're moving on to contraception. This is birth control. There are different kinds of birth control. That includes the pill. This is the most used contraceptive. You have the morning after pill. We have the IUD device. We have sterilization. This would be having your tubes tied for a female and a vasectomy in males. There is the corpus interruptus, that would draw the penis before ejaculation, and there is a rhythm method. There are certain other types of barrier methods like diaphragms and cervical caps, condoms, foams, gels, sponges. There are something called an abortion. It's the termination of the pregnancy. Then there is a spontaneous abortion, miscarriage. A lot of times a woman won't even know that she's pregnant, but then a miscarriage will occur, and she doesn't really even know that she was pregnant sometimes. Then, of course, there is the abortion pill. This induces miscarriage during the first 7 weeks of pregnancy. This gives you a flow chart of events that must occur to produce a baby, and here are some of the devices that are used both by males and females for contraception or birth control. And that is all that we have for the reproductive system.